When a patient complains of dizziness, the first thing we need to do is take a good history. And then we have a full armamentarium of the balance testing that can be performed here. So it's important to have a physician involved early on when you have dizziness. If somebody has an acute onset of vertigo or dizziness, they may first be appropriate to contact their primary care physician in the emergency room to make sure it's not a heart attack or a stroke. Dizziness is a very broad term. It could be anything from a lightheadedness that could indicate a cardiovascular disease. It could also be a symptom of a stroke. And we begin to look for other neurologic symptoms, such as difficulty swallowing, slurred speech, focal or weakness in one part of the body, change in sensation in one part of the body, visual changes, hearing fluctuation. We begin to try to differentiate between a cardiovascular source of dizziness, a neurologic form of dizziness, most severe being a stroke, and look at inner ear forms of dizziness. Symptoms that are more specific for an inner ear form of dizziness are a sense of movement or vertigo. Vertigo is where you feel as though the room is spinning. Is there associated ear fullness or pressure? Is there fluctuation in your hearing? Is there distortion in your hearing? Is there a positional source of the dizziness? Symptoms where there's change in your hearing, fullness in your ear, a sense of rotary or motion, dizziness, particularly if you roll over in bed at night and the room begins to spin, a positional type of vertigo, or recurrent episodes of dizziness. I think it's appropriate to see an otolaryngologist or ear, nose, and throat surgeon.